Thank you, Dr. Ramesh. Hello, everybody. Thank you for this opportunity to share some of the things that we are doing at the Indian Institute of Science. I've titled this as Nurturing Interdisciplinarity for the Future of Healthcare, of course, of which hernia care would, of course, be a very important aspect. So if you just look at healthcare global trends and opportunities thereof, one thing that is very clear is convergence of all kinds, right? Dr. Ramesh already talked about things like artificial intelligence coming into healthcare for providing decision support, telemedicine. And today we are talking of point of care diagnostics and devices. And very soon, we will be also talking about wearable devices, right? And there's a lot of work also happening on, 3D bioprinting. Very soon, hopefully, we will have organs printed as opposed to harvesting the organs from cadavers or, donors. On the other hand, we also have great progress in nanotechnology and molecular biology, which would include gene editing, a variety of omics, be it genomics, proteomics, metabolomics, and so on and so forth. That is taking us to what is called precision medicine, right? And, this will also help us in coming up the right drugs for a particular person, eventually, designer drug, if you will. So all these different technologies, science and technologies are converging onto healthcare. On the other side, you also see that in terms of the delivery, there are new models that are emerging. From the conventional hospital care, especially with the COVID pandemic, there's a lot of emphasis on home care, right? And here, of course, in addition to, healthcare providers, there are whole other players, government, corporates, NGOs, community, all are coming together. And I think the emphasis is really going towards citizen-centered care, not necessarily, reacting for a disease, but really being proactive and ensuring well-being, right? In the midst of all that, we also see a very serious equity issues, on one hand, we have elite few, maybe top billion in the world, who have access to the top healthcare facilities. But a large majority, what you could call the next 6 billion people are still, not able to access the basic healthcare. And there is a huge healthcare divide. And that is where the World Health Organization is talking about 3 A's: availability, accessibility, and affordability. And indeed, COVID-19 has further amplified this. The need for healthcare technology convergence, efficient delivery models, eventually leading to equitable healthcare. In the context of interdisciplinary or cross-disciplinary activities, in the last decade or two at IISc, there is a lot of emphasis in this direction. In fact, there is a division now called Interdisciplinary Sciences Division, which looks at things like, brain, computation, and data science, coming up with techniques to treat, for instance, age-related disorders such as Parkinson's, for instance. A lot of emphasis on cancer research. Quantum technologies, is an emerging area. Perhaps it will enable what one would call a portable, MRI, maybe in the next decade or so. Vaccines, have played a great role where nanoengineering comes in the context of delivering the vaccines, be it, lipid nanoparticle, which enables mRNA delivery, for instance. A lot of work on sensors and IoTs for healthcare, biomedical devices, which Rupesh already talked about, visual analytics and AI that Dr. Ramesh talked about. And all this will eventually lead to what one can call digital health, right? What we have been thinking at IISc is really to do something which would be very unique and different. We are starting a postgraduate medical school, which we believe will set a new frontier. And the reason for that is this will be first such postgraduate medical school under a single umbrella which will have a very strong basic sciences departments, which IISc is known for. Very strong engineering departments. IISc has 100 years of legacy, sciences and engineering research. We are now adding the third, fulcrum, if you will, which is clinical sciences. We believe that the deep science, technology-based discoveries, innovation are really are something which will enable the affordable healthcare, which is a 21st century priority for India and the rest of the world, right? So this is where we need confluence of disciplines, which will be very crucial. And only then we can achieve what World Health Organization is dreaming about, universal right to health. So our vision really is excellence in clinical research, not just clinical care, but clinical research and medical technology. Our mission is to really foster interdisciplinary research to address healthcare needs, create new generation of physician scientists, enable translation through medtech industry and startups, and partner with many stakeholders to pioneer new healthcare models. Of course, we want to, have quality healthcare to all, and we really want to empower the patient. That is where, again, the digital technologies will come in, and the hospital that we are creating will be fully digital hospital, really. This will be, we believe, a paradigm shift for India in the area of medical education and research. We are constructing a 832-bed hospital for clinical research with the emphasis on postgraduate and MD, PhD and MS, PhD program. As I already said, hospital will be fully digital, which will leverage advanced computing and communication technologies. We'll start with focusing on some specific research areas such as diabetes and metabolic disorder, neurodegenerative disorders. We have a Center for Brain Research here, infectious diseases, and so on and so forth. And of course, there will be advanced diagnostic lab facilities, and we really want to enable seamless integration with other science and engineering departments. So this is the Bakshi Parthasarathy Hospital. We have just broken the ground. Prime Minister, did the foundation stone laying recently. The centerpiece of all this is this MD, PhD or MS, PhD program. So this is very common in the US, as Dr. Ramesh was telling. Many things are common in the West. If you look at Association of American Medical Colleges, they talk about physician scientists, say the career of physician scientist is unique, who solves mechanism underlying diseases, ultimately translating to new cure for disease, right? So, of course, inspired by similar programs, we would like to, start this MD, PhD. This would be different from the US model because there, you have pre-med and their MD is equivalent to our MBBS and so on and so forth. But our input will be MBBS graduates. We would essentially sort of create physician scientists and medical technologists, right? And the way it will happen is they will have a concurrent training in medical school, which will also be in the IISc, along with the PhD training, right? MD, MS, as well as PhD training. In the first year, they will, or even in a few months, they will rotate in multiple labs in many science and engineering departments to get a flavor of different areas. And then depending on their interest, they will choose a PhD topic and a guide. Most likely they will have two guides, one from, of course, the clinical faculty and one from either engineering or medical faculty, the science faculty. So they will then work on MD thesis, which will be aligned with the PhD degree thesis. This will be jointly done again in science and engineering labs as well as medical school. In other words, every week, almost on a daily basis, they will spend time providing clinical care in the hospital, learning in the medical school, also doing their bench work in science and engineering laboratories. And towards the end, they will submit a single thesis. They will get 2 degrees, coterminous MD and PhD or MS and PhD. There are a lot of possibilities. We have been talking to many people, this churning is happening for last more than a year now. We have been in touch with many clinicians, and many policymakers and so on and so forth. And we believe that, we will only be limited by our imaginations in terms of what could unveil, from this kind of an initiative, right? And of course, in the context of AI, AI-enabled healthcare will be very, very big, which will eventually lead to what we envision digital health. You could perhaps create a digital twin of a human being. This digital twin can age along with the human being, and you can then do a lot of what if scenario. A lot of drug trials can be done either on the digital twin, or you can also build what is called a body on a chip, not just organ on a chip, but the entire body on a chip, right? Which will eventually lead to perhaps human system modeling, which will be very, very efficient, right? And of course, eventual goal, of course, is precision medicine and a variety of biomedical devices and systems. There'll also be, of course, a healthcare and medtech incubator. The clinicians will know the pain points. They will feed those pain points back into the medical school. That will ideate new solutions. Hopefully that will get translated into new products, right? So this is a kind of closed loop system we would like to envision. So we believe that, we are poised to spearhead a new genre of clinical research. And perhaps this will create a template for many other institutions to sort of follow in the several decades to come in the future. So with that, thank you for this opportunity again. Let me stop here.